Transporting using stretcher.
You must understand the different parts of the stretcher before you start using it. Parts of a stretcher. The stretcher is a critical component of the hospital system. It serves as a hospital bed that can be moved from one ward to another. You must understand the different parts of the stretcher before you start using it. The stretcher is designed with the following parts. The stretcher bed is a flat area with a thin mattress on which the patient is placed. The handlebar is located on one side of the stretcher and is used by the assistant to hold and push the stretcher. The side rails of the stretcher prevent the patient falling off from the side and ensures the safety of the patient. The stretchers are provided with wheels with rubber covering for smooth movement. Wheel locks prevent the movement of the stretcher while the patient is transferred. The stretcher also has provisions for attachment of medication drips and carrying the support systems needed by the patient. The components of the stretchers vary from place to place, but you must be aware of the form and function of the stretcher that you would be using in your hospital. Techniques of transferring a patient from the stretcher to the bed. Before transferring a patient from the stretcher to the bed, report to the nurse about the transfer of the patient into the ward. Once the patient is brought into the ward, the following techniques need to be followed. Ensure that there are at least 2 other hospital assistants to help you when the patient is transferred to the bed. Place the stretcher close to the side of the bed. Ensure that both the bed and the stretcher are stabilized or locked before moving the patient. Lower any side rails present. Roll back the patient onto the sheet. Roll the patient gently to a side and place a sheet on the stretcher. Roll back the patient onto the sheet. Transferring a patient from the stretcher to the bed. Now shift onto the bed and hold the sheet from the side. Ask the other assistants to hold the sheet from the remaining sides. Gently lift the patient with the sheet and shift the patient onto the bed. Get down from the bed. Place the patient comfortably on the bed. Raise the side rails to prevent the patient from falling off the bed. Techniques of transferring a patient from the bed to the stretcher. During the stay in the hospital, a patient may have to be moved from one ward to another for various procedures. Before you transfer the patient, you must plan the procedure by collecting information about the patient's condition from the nurse. The steps involved in the transfer of a patient from the bed to the stretcher are as follows. Place the stretcher close to the side of the bed. As the assistant in charge, ensure that both the bed and the stretchers are stabilized or locked before moving the patient. Roll back the patient onto the sheet. Roll the patient gently to a side and place a sheet on the bed. Roll back the patient onto the sheet. Transferring a patient from the bed to the stretcher. Get onto the bed of the patient and hold the sheet from one side. Ask the other assistants to hold the sheet from the sides. Gently lift the patient with the sheet and shift the patient onto the stretcher. Move the equipment attached to the patient along with the patient. Place the medical records on the patient while moving the stretcher. Remove the wheel locks of the stretcher. Remove the wheel locks of the stretcher and move the stretcher gently to the ward that the patient has to be moved to. Role of hospital assistant. When you use a stretcher, you must understand the condition of the patient before planning the process of transfer. Ask the nurse of the patient about the need for transfer of the patient. Learn about the condition of the patient to plan a safe technique of transfer. In many cases, some parts of the patient's body are damaged or very weak. You should know about those areas and ensure that those areas are not affected when the transfer is carried out. The patient might be provided with medication and support for breathing. In such cases, the support equipment must also be carefully moved along with the patient. Experienced staff should accompany the patient during the transfer, and appropriate documentation and equipment should be available. The receiving ward should also be prepared for the patient. Ensure that you organize the facilities that are required for the transfer.